It's Monday on Your View. Welcome to the show. I am Murayo Afolabi Brown. As always, I have the ladies with me. Hello.
Hi.
Busy in the building.
Excellent morning, everybody.
How are you? We are distanced today.
Yes, so as in, show your hand, show your hand.
We are very,
stretch your hand now. Let them
very
be
far away from
We can't stretch your hand. You can't touch her.
No matter how long the hand is.
She's a lady. She can't do that stretch.
Because we have to comply also to ensure that our droplets don't not spread around. Hiding busy.
I'm doing amazing. So I'm hosting my dad. He came in for a few days.
I would like to meet your dad. I hope he's not going anytime soon.
No, he's going,
They say,
yes. Are you serious? Are you serious? Are you serious? Oh, I got to come see him.
Yeah, so
his twin.
Yeah, I'm hosting him, catching up with
You're not hosting him, he's home.
He's home, yeah, really. But this is the first time he's coming here, so we gist till midnight, we eat and everything, and I'm catching up with everything happening back in his township, because it's not a village, as well as a township, actually. Yeah, so that's what's happening. But I have a shout out from a fan.
Okay.
I actually rejected this one because of what we talked about, that it was, but then Murayo said, no, you have to go ahead. So I sent a message back to her that I will take it. So her daughter is going to be one year. She usually dances whenever Amontad starts playing. So happy birthday to Oluwashindara.
Oluwashindara,
Baba Femi. Happy birthday to you from your siblings Ayomide and Ayomiku Baba Femi.
Wow. Happy birthday.
Happy birthday.
How you doing, Mariam? What's going on? What's happening? How was your weekend?
Weekend was good. The kids went out to friends, and so they were happy, to just help them
to get ready for school.
They have been tired. They're just tired of staying at home. My daughter is really upset that they're not going back to physical school this year. She's like, again, but we just have to do it, because the numbers are scary, and every day we hear about one death or the other from COVID. It's really scary. But I have a shout out as well from Mrs. Elizabeth Adesemoye. She's a huge fan of Your View and her wedding anniversary and birthday wishes. So her wedding anniversary message to her husband, she says, my wedding anniversary message to my husband of 6 years in the person of Mr. David Adesemoye is, thank you for being the best husband to me and the best father to our adorable children. Also for loving me as Christ loves the church and making God the head of our home. Love you for life. Happy birthday. Happy wedding anniversary and happy birthday.
Takwa is back. Yeah. She took a 2 weeks break. How are you doing? Come revived?
Okay, so in the spirit of being honest, it's actually been a very, very stressful period for me, physically and emotionally. But I'm very, very grateful. I'm feeling more myself. I said I had to go back to exercising. I knew that I needed to just get back into my routine because I was just eating my emotions. And as you see, don't come and tweet at me that I've added weight. I am telling you myself, I know already. My cheeks are rounder. My husband is taking good care of me. But I must shout out to all the fans from Dubai. So Mr. Omotayo came to visit me. Like he said, which hotel are you in? I want to see you. He came. Then in the hotel I was staying in, 2 people. Ojo is a fan of our show. He watches it every day. Innocent. It was like, I don't go, no, you remove mask. He's a Delta, but it was like, remove the mask. I know you. I had to go. He said, come out from the lift. Let me gist you. And it was just so interesting to engage with them. They love us. Some people that couldn't come sent their wishes, sent WhatsApp messages. Nice. Thank you for supporting us.
And, we love you back.
Yes, we love you right back. So yeah, that was really interesting. There's a very thriving community of Nigerians all over the world, and in Dubai particularly, they're doing well.
Please, let me do my birthday show.
Please, let me just quickly say something. I want to just apologize. So I've done private apology. I want to do public apology, and I want to put her on the spot. Her name is Mrs. Winifred Chineye Odigie, my senior wife.
Okay, what
happened? So it was Dubai. There was a miscommunication. I've been, like I said, my first discussion was, in all honesty, I was extremely just overwhelmed with work. So she reached out to me and I did not respond, and she's not happy. And I've apologized privately. Now everybody that knows Chineye Odigie apologize on behalf of Tokpe so that it will be official.
Okay, so you guys have stolen my time for banter because
no, please,
today is my daughter's birthday.
Hey!
birthday. So I think we will time for banter, but I have to run because they're telling me that well, we have to run off. So happy birthday to my daughter, Elizabeth, and so we give birth to them on the same day intentionally because we wanted to be economical with our birthday plans for the year.
You will still get to pick.
Finish. I'm getting one cake, Elizabeth and Gabriel. This is my year of investment. I am not spending any money my year. I said.
Gabriel visited Elizabeth.
I don't really think about that. Oh, fantastic. All joy. So we're having the birthday today. And I have to just say one last word. Please help me to wish my daughter, she's 21 today. This is from Mrs. Ogunbanjo Abimbola. No, not him. Mrs. Ogunbanjo yesterday was her birthday, 17th. Okay. So happy birthday to her. And then I got this from Mrs. Ojuolakpe Olanrewaju. Said her daughter is 21 today. Wow. Dikra Olanrewaju, she says, happy birthday to her daughter. Happy so they have to run, unfortunately, run out of time. Let's go on a break. When we come back, we breeze through the front pages. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Okay, we're excited. No, it's Monday. We are serious. No. Let's start with the punch. No, we'll start with the punch this morning. Storage facilities. Nigeria may waste 100,000 COVID-19 vaccine doses, says experts. Buhari, Abiodun, others pay tribute as ex-minister Martin Skuye buried. Senate kicks as Petroleum Ministry spends 98.4 million naira on flyers. Bandits kill octogenarian, 14 others in Zamfara and Kaduna attacks. Envoys list Buhari's post ex-ministers to UK, Spain, Emenike to US, while NIN, FG insists on Wednesday deadline, diplomats registration. Ooh, I thought they moved the deadline for NIN.
But these are diplomats. So it's anyway, a bit different. So
who has the major headline?
Yes, I do. Virologists and other medical experts have said that are warning that if care is not taken, we'll likely waste the 100,000 COVID-19 vaccines, saying that we need to, we've not made proper arrangements for transportation and preservation. Now, we need about 70 freezers on ground before the vaccines come in. We also need to ensure that we have 24 hours power to be able to preserve the vaccine, because you cannot transport that vaccine without a temperature of 70 degrees centigrade while you're moving it to rural areas. Now, what happens if the vaccine expires is that it's not toxic to the body, unlike normal drugs, but then the effectiveness will not be there. So you take a vaccine and feel that you are vaccinated, exactly, and it's not working, you're not safe. So I am wondering, do we have all of these arrangements before it's just getting this?
No, and it's NEPA. It's not Nigeria.
You don't hear say we don't get them.
Don't worry. We're used to having generators here. Don't worry, we'll get the generator. It's not a freezer. They should not allow me really raise alarm.
We transport cold foods now.
Yes, now. So we'll get it done. Let them not raise alarm that is not dead. Let us be sure.
What God help us.
What I'm more interested in is, can we make our own vaccines? That's the way the question is.
Let's
move on to
I have one.
Senate?
Yes, Senate kicks against the... So it's... The Senate Public Account Committee has described as unacceptable the payment of 98.4 million by Petroleum Resources Ministry for the printing of flyers. And also 39 million naira was sent to 2 persons for the purpose of monitoring the ministry's project within the federal government, Federal Capital Territory. And so the committee is asking that the permanent secretary, put in disciplinary measures for this action, because it was, first, the contract that was given did not follow due process. There was no formal contract given, and it did not follow the due process procedure concerning this at all. Although, let me just answer, there's a response from the ministry saying that they followed, what they're saying, that they followed due process, and it was important that they made the flyers so as to bring sensitization and awareness for the projects that were going on, and so that was their response to that.
Okay, it's not. It's somewhere else. Let's move on. I'm sure it's somewhere else. Moving on to the nation. Troops battle Islamic State to regain seized military base. No Pentagon military parade for Trump. Lagos to monitor schools for COVID-19 rules compliance. An important scramble for dollar weakens Naira. Okay, so I read in the papers in the nation that there is actually a parade, a military parade that they actually run to, like a send forth or send off for the outgoing president. But the military has said that no such thing for the commander-in-chief. they're not having that for Trump. And they didn't really give a reason why, because Trump...
do we need a special reason why?
But Trump had organized this kind of parade. I mean, last time he did it in 2019 during the Independence Day. It's a major parade, and unfortunately, they just said that they're
not going to get it.
I didn't really read
story at the end.
Okay.
I don't know if you saw
Minister Kuye?
No,
the military raised in Oyo.
Yes. So in Gas Seriki village in Oyo State, there was a clash that happened, which started on Thursday, and according to the story, a very popular indigent, Sunday Adeyemo, went to visit the Seriki Fulani of that area and was, talking to him about the fact that the Fulanis are killing a lot of their people. But while he was doing that, the people that came with him went into the village and started raising down huts. So when they left, the Fulani youths were angry, and then they took a reprisal attack and killed 4 young men coming back from the farm. And so it's been ongoing. 11 huts raised, 3 people injured, 1 person missing.
Okay, let's move on to Vanguard. 24 killed as bandits, cultists go on rampage. Why we won't support Igbo presidency in 2023, says IPOB. NIN mandatory for foreign diplomats. COVID-19 experts worry as gaps in national response drive new cases. Talk about, you're going to take NIN?
Yes, the NIN story, the Minister for Communication and Digital Economy, Dr. Isa Patami, speaking through his technical assistant, Femi Adeluyi, said that for all foreign diplomats that are in Nigeria for a 2-year period minimum, they all should get their NIN, and they'll be setting up a place within the Ministry of Foreign Affairs starting from the Tuesday 19, that's tomorrow, for all of them to come and get registered for NIN.
Yeah, and I saw that, and I was thinking that if that can be done for many other places, that would go a long way in helping people, so that congestion that you have at those designated NIMC centers
so their offices, their companies, their
so send them around. If that's something that can be done, and do them everywhere else.
Okay. There's another story in Vanguard, the IPOB. Yes.
Yes, so indigenous people of Biafra has said that they are not going to support Nigerian president of Igbo extraction because the people who are going to come out for this presidency are likely going to be stooges that will be used against the Igbo people and Biafra. So they mentioned 2 incidents. They talked about Alex Ekweme contesting for presidential. He was a presidential candidate in 1999. He was not supported by his people. Peter Obi in 2019 also was not supported by his people. And that all these people, now is their turn and they want support. At the end of the day, the people that be will use them against their own people, so they are not going to support them at all. And I'm wondering,
can we just have a united country?
Moving on to the Nigerian Tribune. Schools resume amid COVID-19 spike. Edo government deploys police constabularies to arrest persons without face masks in public places. Picture here of Governor Yahaya Bello of Kogi State, flanked by some elected and appointed women of his administration during the conferment of the most gender-sensitive governor award. Wow. APC membership revalidation, tension as chieftains battle for party structure supremacy. FG has refused to renew passport of #NSAS protesters, says Falana. School experts prefer way forward. You can't hide under subsidy to punish Nigerians, says Labour. Which story do we have here?
Let's first start with INEC, because elections are coming and INEC has listed 5 challenges they are facing, and I think the government needs to address it quickly. One, they said that one of the challenges is continuous voters registration in the face of the pandemic. How does it happen? Also, they mentioned expanding the voters registration process, and there are new settlements across the country, especially with the displacement of people, that they haven't been captured at all.
Wow.
They also mentioned the challenge of updating the Electoral Act to improve free and fair election, rolling out voting machines in Anambra towards the governorship election. So if our democracy is still fragile, can we do all that we can to ensure everybody feels like they are among in this issue, especially from the backlog of NSAS crisis?
Edo State. Okay,
yeah, go to Edo State. I want to take the NSAS crisis.
Okay, so the Edo State governor has deployed 800 constables across 18 local governments to ensure that anybody who does not wear their face masks in public will be prosecuted. So there's a mobile court that they had set up for prosecution, and they will likely pay fine and do community service. So he's saying that this is one of the measures he's taking to ensure that they curb COVID-19 are being transferred to everybody.
Coming back from Dubai, Morayo, everywhere you go to, as you're entering, everybody's like mask up, everywhere, and they give you free. They give you nose mask free everywhere.
COVID is our focus. They will talk about COVID, and we'll hear your experience also.
So, you said
NSAS, we have to run.
Yes, NSAS, the human rights lawyer Falano has said that 3 passports of 3 leaders of the NSAS protest hasn't been renewed in over a year. The federal government are yet to renew the passports of these people, and I think that
is it renew or release? I thought it was
no, it's renewed.
I know it's renewed, but I was wondering why it was
supposed to be. You said renew.
I have the names here. It says the passports of Bola Tito Rachel Oduala, Mary Oshifora, and Mopelola Odesheye. Their passports should be renewed without any further delay.
Yeah, the process was last year.
Maybe
it's expired, and government needs to renew. So since they cannot, if they don't renew it, they can't travel anyway. So you give them the passport, but it's useless to them since they don't have a valid passport.
That's all we can take on Front Page Review. When we come back, our topic today, the issue of coronavirus and the resumption of schools. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So, despite the rising cases of coronavirus in the country, most schools across the country are resuming physically for academic exercise today. The House of Representatives came out through a press release opposing the action of the federal government on schools resumption. Joining us on the show is the President, National Association Proprietors of Private Schools, NAPS, Mr. Yomi Otubela. Good morning, sir. Are you there? Mr. Yomi Otubela, are you there?
Good morning. Thanks for having me.
Yes, good to have you. And we also have the Chairman, House Committee on Basic Education and Services, Professor Julius Ihonvbere. Good morning, sir. Are you there? Then we have the Head Infectious Disease Unit at the Lagos State University Teaching Hospital, LUTH, Dr. Iorhen Akase. Good morning, sir. Are you there?
Good morning.
Dr. Akase, good to have you. Gentlemen, thank you for joining us this morning. I'll start with you, Mr. Otubela. Schools have opened physically across board. As a private sector organization, how prepared are you for resumption?
Yes, thank you so much. We want to say here that all private schools in Nigeria under the auspices of National Association of Proprietors of Private Schools are more than fully prepared for resumption of all children in primary and secondary school. You will recall that last year, September, the NCDC and WHO gave protocols, COVID-19 protocols that are supposed to be maintained within the school environment. And these we did within the school last term, and all these protocols are still in place. We have equally done a refresher program for all teaching and non-teaching staff before resumption. And further information from medical experts had also revealed that even though the infection can affect all ages, but there are statistics that show that very little proportion of children are affected. And we have also understand how the COVID-19 also works. And that has given us a much understanding and strength to know what to do and how to handle the prevention. The application and the observing and sustenance of the non-pharmaceutical protocols is what we rely on within the school environment. And you know, school system is very, very orderly, more than any other public place in the environment. And all our schools are also under the supervision of a committee that is set up by the association called COVID-19 protocol team. This team is to go around the school to see that all the non-pharmaceutical protocol put in place are checked from time to time, and they advise schools management as to its sustainability. We also have Parent Teachers Association collaborating with us, where all PTA or Parent Forum, as it may be called in different schools, also have a rotational team of parents who also come to school from day to day to see the observance and the sustainability of all the non-pharmaceutical protocol within the school. Since parents are also involved fully, we hope that lapses will be minimal and we will be able to protect and save these children. And we can continue saving lives and also saving livelihoods.
Okay.
Okay, so another question for you. I am particularly worried about the teachers and the caregivers who will be going home and coming back. Is there a provision to ensure that they are conveyed home and brought back, or are they going to be allowed to go in their either private vehicles or their public buses coming back, because there is no testing that will be done every day for them to get into the school to show they do not have COVID-19? How do you plan to handle that?
Yes, what we have done, like I said in my opening remark, is that we have done a sensitization and refresher seminar for all teaching and non-teaching staff to know that it is the responsibility of every individual to own the fight against the spread of this COVID-19. And in doing so, they will not only maintain all the precautionary measures put in place within the school environment, they will also ensure that they observe these while they are outside the school. Just as parents also leave their home and go to work, these teachers are also parents who also leave their home and go to work. And government has already rolled out all instruction for everyone, irrespective of your profession, to ensure that you observe all the non-pharmaceutical protocol. And this is what we are relying on to ensure that when they are going home, they ensure that they don't take more than necessary people in their personal vehicle and observe social distancing there. And if they must go with public transportation, they must as well ensure that they look for one that can give respect and observance for these government regulations on the spread of COVID-19.
Okay, sir. Another question. One of the things people have been complaining about is, and I have a complaint about, is that we don't have statistics that would link school resumption to increase in COVID cases. Do you have is it agreed within private schools to test teachers before resumption and after resumption? We've had 2 terms with COVID. Was that done before this resumption? And has there been spike in infection of teachers during the past term? Do you have the numbers for cases of teachers getting infected?
Thank you. There is a policy in place that anyone who is ill or show any signs of sickness, either it is COVID-19 or not, especially when such person is among the stakeholders within the school system, such a person will be subjected to a test of COVID-19 and we will have to seal the clearance and negative results to allow such a person to return back to school. Either a teacher or a student, once you are seen to be down with some symptoms, that is can be
most people are
traced to
asymptomatic.
COVID-19. So some of these symptoms are similar to that of malaria and pneumonia, according to study. We also ensure that once we have that, we text whosoever is involved. We don't text everybody without having any information that such a person is showing any form of illness. It is when they show this, first of all, they don't come to the school environment. Once you are sick, you report back to the school through phone call or a letter from your relatives that you are down. And of course, we will request you to present such a test before you come back to school.
Okay, go ahead, man.
Mr. Otubela,
and I must add here that we have not recorded any teacher in the private sector who is down currently or in the past when we resumed for last term for COVID-19 related.
Okay. All right, let me get you one more question before we go to Dr. Akase. Yeah.
Okay, so Mr. Otubela, I don't know if you're aware of the NMA, ASU, you know, even the House of Reps, they're just not comfortable with schools reopening. And also, having listened to what you have explained as the non-pharmaceutical procedures that people need to go through in order to be present, I also don't feel confident that children should be back in these enclosed environments just yet.
Yes.
But I don't know, is there anything...
Yes, I'm aware of the concern of...
Okay, so given those concerns...
I'm aware of the concern.
Go ahead, sir. Okay.
Oh, thank you. I'm aware of the concerns of different stakeholders, including the House of Reps Committee on Education, the NMA, and some other stakeholders in the society. Just as they are having their worry, so also all of us in the National Association of Proprietors of Private Schools are also worried, because we are also parents and we also have children who are attending schools in one level or the other. So, but we have been able to mitigate our worry by equipping ourselves with information. All our actions are premised on facts that scientists like NMA, NCDC, WHO, and others have given out. And the first of them all is that one of the ways to curb the spread of this virus is to observe all the non-pharmaceutical protocol. If they believe in that guideline and it's working and there is no contrary to that, then we should take care of our concern on the fact that those non-pharmaceutical protocols will protect us. The second issue is that UNICEF had confirmed that schools is not the driver of the spread of COVID-19. We are also taking our decision from that information, knowing fully well that when we resumed last term until now, we had not recorded any significant positive cases of COVID-19 within the schools in Nigeria. Yes, I know we have one that was recorded in one of the states, and it was confirmed that those children came from home with it. Even the one that was confirmed somewhere in Lagos here, it was also traced from the fact that they came from home with it. So what we are saying here is that school is most organized place in the society, even more than some home.
All right.
There are some children that come from a humble background who their home does not give room for such social distancing or a good hygiene. Because of the level of hygiene and orderliness in the school, we are sure we can protect the spread of this COVID-19.
Okay. All right.
Finally, please, we also have information that this COVID-19, even though it affects all ages, rarely affects children. And where they are affected, they are merely asymptomatic. So even when if they are home, if the school is closed down, you will realize that the aftermath effect of closing down schools will affect more generations to come, not even now. And we should not focus on physical health issue, which has to do with COVID-19 now. We should also know that there is this mental health challenge that children and parents are facing. And that one is more deadly and dangerous because it is not seen physically. It won't be hopeless until they start killing people. And I'm saying that a whole lot of children, when they are locked out of school system, even their parents, could lead to some emotional health.
Let me go on a quick break. When we come back, we'll talk to Dr. Akase on this because it's important for us to get the medical perspective on this. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Hello, sir. Are you there?
I'm here.
All right. So, yes, you were there, but I'll join you. I'll be with you in a second. Let me go to our doctor of the head infectious disease unit at the Lagos State University Teaching Hospital, Dr. Iorhen Akase. Good morning, sir. Are you there again?
Good morning.
Yes, Dr. Akase, let me come to you because you've heard what Mr. Otubela told us about preparedness of the private sector. As somebody who's heading the infectious disease unit at LUTH, in your view, is it a good idea to have the children come back to school?
Yeah, thank you for that question. I think generally what we've observed and what has been responsible for the rather rapidly increasing number of cases has simply been the inability of society to adhere to what has been known. And the knowledge is out there. The meetings have been held, and somehow institutions or people have been unable to keep to that. My concern really is that we are both giving conflicting messages to people in the society that it's okay to move on, and also trying to compartmentalize or institutions. Why schools may be safe, schools do not operate in isolation in society. If parents will need to take children to school, there's going to be a lot of interactions that will emanate from schools opening. So while I have no doubt that institutions have put in place guidelines to make sure that their own staff and patients are safe, there is no argument that asymptomatic people are the major drivers of this rising number of cases in society. It's not even the people with symptoms. It is those that do not have symptoms. Opening schools and opening institutions passes across a message to the other members of the society that there is no problem and that we can move on with our lives. And this really is what is fueling the behavior of people who are not in institutions. For example, people in the motor parks, people in the marketplaces, people on the roads, who are getting the impression that, there's no problem, that it is okay to move on. And I think this really is the most dangerous aspect of, reopening institutions and saying things should go on, as usual.
All right, so let me even ask this, because what I perceive is that COVID-19 is going to be our new normal for a long time. It hasn't given an expiration date. There's no intelligence telling us if we stay back for 3 months or close for 6 months, by the time we're back, COVID-19 would have been gone. Now, what do you say about preparing or positioning ourselves in such a way that we live side by side with COVID-19, even with the school? Shouldn't that be where we're looking at? Because we do not know when COVID-19 will be eradicated.
So this is very true. However, at the moment, why this has become pertinent to discuss at the moment is the fact that, for some reason, everybody knows, and this science clearly has shown that, as we observe in China and or elsewhere, that if you strictly adhere to these 3 principles of wearing a face mask, doing hand hygiene, and applying social distance principles, to a large extent, you can move on with your life. Unfortunately, in Nigeria, we have not done that. And I feel that even though we keep saying, put on your face mask, do your hand hygiene, people are simply not listening. So we are at a stage where we must be able to change the kind of message we're passing on. It's not enough to come up and tell people, put on your face mask, when we are telling them that even though we know nobody's putting on face masks, it's not a problem, we must move on with our lives. Lockdown is not the answer, I must say. And closing our schools permanently is not the answer either. However, where our message has not gotten across, I think we must be able to find a way of delivering the message. And I think that if, for example, there's drastic measures are taken, for example, of shutting down, and people begin to ask questions, why are schools closed down? You can tell them it is because society has not done what they're supposed to do. Right. And until we collectively do that, the truth of the matter, we must collectively do this. We cannot leave it to the hospitals or the health officials or the government to, end COVID-19. Or even if vaccines come, everybody knows it's going to take a while before we reach the level of immunity to carry on with our lives. All right. So until then, we all have to make sacrifices. Right. Healthcare workers are making sacrifices. Business are making sacrifices. Everybody must chip in. And until that message gets across, I don't think it's okay to say we must move on with our lives.
All right. Let me bring in Professor Ihonvbere to this conversation. Sir, people are saying that there's a bigger picture. Professor, are you there?
I'm here.
Yeah.
I'm here.
So some people are saying that there's a bigger picture, that Africa has not been able to catch up in development across the world. We are already still playing catch up. Now, with this COVID-19, it's going to further widen the gap with the West. So the West, yes, there's COVID-19. The kids are having to stay home, but they have options. They are online. The schools are able to continue education online. Africa will further widen the gap of poverty if we refuse to ensure education carries on even in COVID-19. What are your thoughts on this? Do you think it's a must for us to reopen, or do you believe that we should go, as the doctor has said, close schools for now?
Well, I will say that your perspective is quite correct. And the reason why Africa has always lagged behind is because of the quality of leadership, the quality of governance. With bad governance, human rights abuses, widespread corruption, and accommodation of political and social rascality, you cannot move forward as a nation. Schools have to open. We have to learn. Unlike Dr. Akase, my brother there, just said, I think he captured it excellently. Right now, we are not prepared. We have not taken into consideration the safety of these children. The fact that they may be asymptomatic or their immunity levels are higher than that of adults, they interact with their parents at home, with visitors. They go to the market, they go on errands. So I think what is happening is that we have reopened schools, but we've not done the necessary, put in the necessary requirements. The Federal Ministry of Education itself set up a template for school readiness. No state has implemented 20% of that, of the template, of the items in this template. Lagos is doing well. There's more to be done. Ekiti is doing well. Edo State just joined by saying, if you come outside and we find you without a face mask, we would arrest you. That is the political will, the courage we're talking about, just like Sanwo-Olu did in Lagos. People are taking this as a joke. You go to the rural areas, the schools have no water. They have no fences, no gates. They have no chairs in the classroom. You are putting these children crowded in one classroom. How on earth are they going to learn safely? The teachers, the Federal Ministry of Education said that all teachers must conduct a COVID test, and they should establish a database that the teachers are safe to even teach the children. How many schools have done this? How many states have done this? A database on the implementation of basic minimum of adherence or compliance with COVID protocols. How many states have done that? If you go to the capital cities, yes, you will see all the Rams matters. But step outside the capital cities, I tell you, 98% of our primary schools in this country, even secondary schools, have no water and no preparedness. Yeah. The handlers, the trainers have not been trained. The Federal Ministry of Education says that should happen. Those who will be handling the children, you have to enlighten them so they can enlighten others. This has not happened. So I think our position is not that schools should not reopen. No. Right. We need to open schools so that we can continue to learn. But
let me get one more question in for you.
Go
ahead.
Dr. Akase, actually.
Yeah.
Dr. Akase, please, to you again. Earlier on, while we were speaking to Mr. Yomi Otubela, he explained that in making a case for going back to school, he said that there are other issues apart from COVID that are even more dangerous, like mental health. And that will be even more dangerous. That it's more dangerous for parents and children and teachers, being at home than going back during a pandemic. Please, as the doctor here, could you explain to us how true this is, or if it is best to just stay home and the pandemic right now may be more dangerous than what may be the perceived mental health from staying back at home?
Thank you, and I think, so I agree with Chief Yomi that, yes, there are mental health issues with children staying at home and all of that. However, the other side of it is that there are even stronger and bigger mental issues with post-traumatic disorders that can come from children losing their loved ones that they know. A child who comes back and eventually finds out that, oh, it is because I went to school that my grandma died. He's going to live with that for the rest of their lives. So this thing applies to both sides of the coin. And at the end of the day, you cannot, in trying to solve one part of the problem, create a one that is...
Oh, we're having some connection issues. We're going to quick break. When we come back, we'll continue this conversation. Stay with us. We'll be right back.
Your View will be right back.
Thanks for staying with us. So we still have our two guests in the studio, Professor Ihonvbere and Dr. Akase. But first, let me quickly take our education correspondent, Sharon Ijase. Good morning. Are you there? Ijase. Sharon, are you there? Good to have you on the show, Sharon.
Yes, I am.
So you've been going around schools to inspect. Yes. Tell us, who are you ratting out? What's going on? Where are you? And how is compliance on your end?
Okay, I'm at the government senior college at JK, and it's been a mix of emotions for students who have to resume school despite the COVID-19 pandemic. Some schools visited, it was zero compliance to COVID-19 pandemic safety guidelines. But there were some other schools that we visited, especially the ones that the Commissioner for Education visited. We could see that some of the schools complied with the safety procedures such as washing of hands, wearing the face mask. But as a reporter, it's not total compliance, and we have to also remember that professional bodies like NMA and NUT have said they can't stop the government from reopening schools, but it's of utmost importance that schools adhere to safety procedure as recommended by NCDC.
Sharon, when you say they did not comply, how do you mean? What exactly did you see?
Of course, before resumption, at about 8 a.m., we could see students moving around in groups, excited to see themselves once again. We could see some of them not wearing their nose masks, and we could see some schools that did not have running water. Wow. So also, we saw some schools that had lots of running water, and some of them wearing their nose masks. So, of course, we know that the Lagos State government has done some training for the teachers. More education needs to be given to the students towards ensuring that they know what the world is battling with COVID-19, and they also have to be responsible to ensure that the spread of COVID-19 is reduced seriously.
All right.
Yeah, Sharon, I just want to know if you notice if there's any physical distancing happening within the schools. Because sometimes they may have the nose mask, they might have running water, but how are they conducting themselves within the premises?
Well, for most of the classes, from my observations, there was low turnout. Not much students resumed school today in Lagos, Nigeria. But maybe because of that, we would observe that for most of the classrooms, there was spacing in terms of the seating arrangements. Okay. But for how long this will be able to be adhered to for the next couple of weeks or months, we'd actually have to keep up on that. But also have to remember that there's like Enugu State, for example, each school must have 2 nurses for them to reopen. And that was the standard that they created for themselves to ensure that teachers that have been trained also have someone that is monitoring to ensure that they keep to the safety guidelines recommended by the NCDC. We are also aware that Edo State and Anambra State have suspended resumption of schools till sometime in February. Lagos has taken the lead with other states like Enugu or Yor, but of course many parents and educationists and professional bodies are of the view that safety guidelines needs to be adhered to.
All right, thank you very much, Sharon. Thank you for giving us an update on that. I do know that Lagos State government have the Achieve and Shine group, so they group the kids into 2 groups, Achieve and Shine. So some Achieve, they come 2.5 days. They don't come every single day, and they are grouped in days. So I know every government is finding ways to ensure they can adhere. Let me come to Professor Ihonvbere. Tope had a question.
Sir, I feel that you've given a lot of information. That means you understand the challenge you're facing. But you happen to be in a position to help solve a bit of this problem, apply pressure when necessary. So I happen to have just come back from Dubai a few days ago, and the level of compliance with nose mask is like almost at 90-something%. If I'm not saying 100, I don't want to say 100% because it will look like I'm exaggerating. But everywhere, we didn't have a choice. Everywhere you go to, everybody you're seeing wearing nose masks. As a country, I don't think that we have seen enough body language from the National Assembly to help put pressure on the State Assembly and the nationwide campaign to ensure nose mask is compulsory. So what are you doing, sir, in your position of power to ensure that there is high compliance with nose mask wearing? Because we know that's the first line of defense.
Thank you very much for that. And I must commend the governor of Lagos State for showing the light on how things should be done. He has shown political will and courage in the face of opposition. Now, what we are doing here, we started trying to make sure that we support the relevant ministries in terms of budget. We've done that successfully. The Speaker has also advised all members, go to your constituency where it is feasible and carry out public education. In my constituency, I did over 15,000 face masks. I produced sanitizers. I fumigated schools and markets. And I had public education in markets and other areas to let people know what the protocols are. And many of my colleagues, including senators, have done similar things. If there was support from the local government council, 774 of them, and all the state governments, if there was synergy, I'm sure the impact will be much higher. Many states, as you know, dismantled even their campaigns when they thought COVID was over and things were returning to normal until the news spike. And I've not seen the rush to reinstate some of these dismantled processes. But you see, it is political will, vision, courage, leadership by example. You see, what do we see around the world? Presidents and prime ministers go to take the COVID vaccine on TV. It's to encourage their people, to let them know it is important. I'm your leader. If I can do it, you can do it.
Professor, I know some people might
National Orientation Agency.
Professor, let me pause you for a second, because some people will say that the Nigerian citizens also have a responsibility to adhere to this, because whether we like it or not, the information is out there on COVID. But how are we also taking responsibility ourselves? Many of us go out there and don't refuse. I mean, are they going to take a whip cane and start whipping us to wear face masks? We also have a part to play in this.
Everybody is reminding the other person.
Sanctions is number one. Sanctions. Like Lagos has said, and Edo is saying, we find you outside in a public place without face masks, you'll be arrested and charged. That is the language some people want to hear. There's a whole team going out there campaigning that COVID is not there, it's not real, it's a scam. I've seen that online, I've seen videos. So sanctions, public education.
Okay, let me go on a quick break.
You have to keep repeating it until people learn that this is the reality.
Right.
And then providing the facilities so that people will know you mean business.
Right.
Students are resuming. There is no sanitizer. There is no face mask. Some may not be able to afford it. Some are go to the rural areas. You see how people are living. Then you in the same school, there is no water. And you've not made arrangement for a bucket with water and soap and maybe serviettes for people to clean their hands thereafter.
Let me go on a quick break.
How do people take you seriously?
When we come back, we continue this conversation. Stay with us. We'll be right back.
Stay tuned. Your view will be right back.
Thanks for staying with us. So we're still on the issue of COVID-19 and resumption. Yes, Mariam.
Yes, Dr. Akase, I just wanted to ask, sometimes when we talk about the guidelines and what to do about lockdown or no lockdown, there doesn't seem to be like a very concrete plan. So it's like everybody's afraid to be the one to bail the cat. So like earlier, we're asking, can we have like a 3-month plan and say, okay, stay home, lockdown 3 months, and in 3 months, this is what will happen that can allow us go back into society and, face our businesses, go back into school. But we don't get that. Everybody says, use face mask, wash your hands. And even that, we have heard of people who say they did that and they contacted the virus. So what can we have as a definite plan medically so that people can work with that, that plan for, to see how this works out for the future?
Okay, yeah, thank you very much for that question. So lockdowns are intended to, like a last grasp measure, intended to accomplish 2 major things. One is to reduce interactions amongst people, and so therefore interrupt the spread of infections. But secondly, and equally as important, is the behavioral and attitudinal change that lockdowns, inculcate in people after they've come out. So usually during lockdowns, people, like what you have in the UK, they have classified their cities, divided them into areas that have high intensity and low intensity. What lockdowns do, one of the things lockdowns should do is to help us have, ideas about where there are pressure points and where, things are tougher, so that at the end of the day, we have a strategy of, okay, this place can reopen first, why this one holds on, for a number of reasons, probably because the numbers of cases are higher or people are not cooperating as much. Because at the end of the day, lockdown is not the answer to controlling pandemics, really. It is the fact, like you rightly said, passing across the right and people doing that. So I agree with you. Most times, when we just lock down and reopen at the same time, it sort of passes across the wrong message. And earlier on, like we saw, Lagos State and Ogun were the ones, and Abuja, I think, at the beginning, were the ones that were supposed to lock down. So right. I think that kind of coordination and strategy is very important. It's not just about, so lockdown is not just intended to stop infections, but to also give us an opportunity to study and understand how to strategize going forward.
Okay.
All right, Professor Ihonvbere.
Yes, please.
You know that human interactions is what actually increases COVID-19. And right now, I'm aware that the NYSC orientation camp will be resuming very soon. My question is, do you think that resumption is necessary, knowing that they can actually receive online orientation and then posted to their different locations to serve? Do we need to gather people for that orientation camp right now? Do you think it's necessary? Can we avoid it?
Well, I think for NYSC, these are graduates, they're matured adults, they are educated, they can easily learn, and the camps can be avenues for inculcating proper education on the COVID protocols, which they can take to their places of primary assignment. And these trainings take place in the open air in fields, so it could be adequate social distancing, physical distancing in a public field in the primary school or a secondary school or in the camp where they were established to do it. So I do not think there's a problem with that, provided, just like in the case of school reopening, we take seriously the issue of compliance with the basic protocols and public education and monitoring and evaluation of the processes so far. Right. The school reopening we're talking about now, I've not seen any template that says in the first month or 2 months of school reopening, we would do a certain monitoring and evaluation. I know there's a limit to which the federal government can control the schools. But I want to say for the primary schools, which are my own basic constituency, no primary school, 90% don't have water. They don't have a single gate, which the federal government prescribes, and no fumigation, decontamination has taken place before you put schools in.
All right. Let me come to Mr. Otubela. We know many high-end private schools use the blended learning model, where they have online and physical learning. But many low-income private schools are struggling to even have a proper system in place to manage this entire period. In your view, what support are you giving to those lower-income private schools that they have no choice but to have everybody in their schools at this time?
Thank you for having me once again. It's a pity that I was cut off from some parts of this program. I would have loved to get the summary of my leader, the prof himself, on what specifically are the major concern of the House Committee concerning not supporting school to resume. And are we talking in general, or we are picking those areas where the actual protocol has not been put in place? Why I will be expecting feedback from that, I want to say here that while I was logged out, I just received the Honorable Commissioner for Education, Lagos State, in my school, Lagoon Schools in Lagos here, just about the hour of 10 o'clock this morning. She came with her entourage to inspect all schools within our axis here, and she just finished inspection of her own school here. And I must say that just like her counterparts in the House Committee on Education in the House of Assembly in Lagos did during the first time resumption, our school has just been confirmed to be ready and that classes can continue. So this is another confirmation that once the scientists have given us what we need to put in place, and the regulatory body also be on top of their duty to inspect and confirm that things are in place, and enough sensitization programs also come out from governments. I have not seen that much coming out from governments. In the past, when we were growing up and we have to take one polio vaccination or the other, then there is a part that the local government authority used to play by going from street to street with megaphone to sensitize people in their local diets.
I have very little time
and all that we have not in this
I'm sorry, I have to cut you off, Mr.
COVID-19.
Otubela. Let me let Professor respond to your initial comment so that I can run off. I have to go. Professor, would you like to respond to Mr. Otubela's question earlier?
Mr. Otubela and I were on the same page. We believe in the house that schools should reopen. But it would be criminal, it would be wicked to open schools where the basic minimum package of compliance with COVID protocols have not been put in place. In school, for example, it's ready. But we feel that this is an opportunity for governments to rise up to the challenge.
Okay. All right.
Have the necessary political courage and political will and vision to fix these schools. What does it cost to provide water in schools?
Okay.
What does it cost to...
Yes, let me let Dr. Akase just give us his final words on this. Dr. Akase, 30 seconds.
Okay, thank you very much. It's been a pleasure discussing with Prof and the Chief. Well, like we're all saying, like Prof said, we're on the same page here. Schools need to reopen. However, schools are not an isolation of themselves in society. So long as society is not carried along, schools reopening will only expose us to more trouble going forward, because we're passing across the wrong message by saying we are okay to move on, while in truth, we're really not. So it's important for us to, if schools are not reopening, just partly because we need to pass across the message to society that we are not ready to counter the effects of COVID-19.
Unfortunately, that's all we can take on the show. Thank you, gentlemen. We've been speaking with the President, National Association of Proprietors of Private Schools, NAPS, Mr. Yomi Otubela, and also the House Committee Chairman on Basic Education and Services, Professor Julius Ihonvbere, and the Head Infectious Disease Center of LUTH, Dr. Akase. Thank you, gentlemen, for joining us this morning. I appreciate your thoughts and views. That's all we can take on the show. Have an amazing day. See you tomorrow. Bye for now.